Well, right now, the Centers for Disease Control and Prevention is reporting nearly 1,200 confirmed cases of the measles across the country, including some here in Arizona. Maricopa County health officials reported someone infected with measles traveled through Sky Harbor Airport just last week. So we want to ask the expert this afternoon. Joining us now live in studio, Dr. Russell Horton, the Division Medical Director for Banner Medical Group. Doctor, thank you so much for being here.
My pleasure.
So first, let's tell our viewers, if they don't know, what is the measles and how does it spread?
Yeah, measles is a viral illness. It's been around for a really long time. It spreads incredibly quickly because you can get it by touching someone, you can get it from them coughing, sneezing on you. Since we had the vaccine, we've seen the rates go way, way down, but now, unfortunately, it's starting to make a comeback.
So, and you're starting to see a lack of people getting their kids vaccinated. They can get vaccinated as early as how old?
A year old
Okay.
is typical, yeah.
And then if you're an adult and you feel like you've maybe been exposed, what should your concern level be?
Yeah, I think if you think that you've been exposed, you may be having symptoms, you should definitely talk to your doctor. There are ways to check if you still have antibodies from your previous vaccine, or if you're not sure, it's always pretty safe to get another one to be on that safe side.
Okay, you can't overdo it then, so to speak.
No, these are very safe things, these vaccines.
Okay, and when we talk about the numbers, is that something that should be concerning for the general public when we're seeing 1,200 cases spread out across the entire country?
Yeah, I mean, we went from 20 years ago saying measles has been eradicated to now we're seeing these 1,200 cases. We're seeing it in Arizona. So yeah, we absolutely need to get the herd immunity back up or it's just going to keep spreading.
And I think it's no secret that people are a little gun shy following the pandemic about vaccinations and whatnot. So how can you reassure the public that not all vaccinations are exactly the same? If they didn't want the COVID shot, the measles one is different.
Yeah, the COVID vaccine was new technology and it's very cool technology, but the measles vaccine, the typical childhood vaccines have been tested for many, many years. They're the most researched type of drug that we have. So I can reassure everyone that it's incredibly safe. All of them, all the vaccines, but the measles vaccine is included in that. The side effects are extremely minimal. The side effects you hear about that are really scary are not true. Those have been debunked. So yeah, definitely we want to encourage everyone to get those on schedule.
So side effects of the vaccine aside, let's talk about the symptoms of the virus. What are people going to be experiencing if they have been exposed?
Yeah, so it's a bit of an incubation period, meaning when you get exposed, it can take a week to 3 weeks to really see symptoms. Usually it starts with cold symptoms, and then we say the 3 C's, cough, coryza, conjunctivitis.
What is coryza?
Coryza is a fancy doctor way of saying that you have a runny nose.
Okay, guys, write that down. If you have a
it
runny
makes us
nose.
feel good to use fancy
Sure,
words.
I understand coryza.
So yeah, those, and then you can start to have fevers, malaise, and then a few days later you'll get these white spots in your mouth called Koplik spots. And then a few days after that is the typical measles rash, which starts on the head, up near the scalp, and just drops down your body.
Sounds aggravating as all get out. So
it's painful.
Obviously we've seen a couple photos of rashes. Is that typically what they're going to see too?
That's,
externally?
Red, bumpy, it's kind of all over. I would say that we really want to make sure that people understand, yes, that is the typical symptoms, but the reason we vaccinate is because it's incredibly dangerous if it gets worse. You can get swelling around the brain, respiratory failure, pneumonias that kill kids. I mean, this is a serious disease.
Yes, sir. Dr. Horton, thank you for coming in and detailing it for us. We appreciate having you.
Thanks for having me.
Yes. Troy?
Good information. But the next time I have a runny nose, I'm going to go to my family and say, I think I've got coryza.
Yeah,
They're going to say, what?
They're going to be concerned. Don't scare them.
Coming up next, a cargo heist involving